Hi, Liberty family. My name is Dr. Erica Parazo with Liberty Rehabilitation Specialists, and this week our therapist will be discussing type 2 diabetes. In fact, Dr. Angela Martin will be hosting a live webinar this Thursday at 1 o'clock where she'll discuss a ton of information about diabetes, and participants in the webinar will have an opportunity to ask Dr. Martin questions. So if you're interested in attending that, you can keep an eye out on this Facebook page for that event and RSVP. But today specifically, I'll be discussing blood glucose monitoring in relation to diabetes, because that's something that people with type 2 diabetes sometimes have to do. And monitoring it can help people with type 2 diabetes kind of determine if their levels are too high or if they're too low, or it can help people manage their diabetes, and it can look at the effect on different types of food, of illness, and of exercise on their blood glucose level. So if you eat a big meal or eat a big piece of chocolate cake like I just did, we can look at the effect that that has on blood glucose. So you can test your sugar at home, your blood sugar at home, with a portable electronic device called a blood sugar meter, which I happen to have here in my household. So I am going to be demonstrating that for you today, and then we'll talk about kind of what the numbers might look like and what those numbers mean. Okay, so you can see that I have my monitor here. I have my blood sugar testing strips, which I'll insert into the monitor. I have what's called the lancet, or the needle, that will be doing my little finger prick. And then I have some alcohol swabs that I'll use to clean my fingertip before I use the needle. So first you'll see me here cleaning my finger with the alcohol swab. And then I am going to prepare my test strip by inserting it into the monitor. And then I choose a finger. I chose my pointer finger, my index finger. And you want to do the prick on the pad of the finger, but kind of to the side, because you can sometimes feel a little sore after the prick, and you don't want that to affect your day-to-day activities. So you'll see I chose a spot kind of to the side on my fingertip there. I am going to use the lancet to do my little finger poke, and then I'm going to give my finger a little squeeze to kind of get the blood to start coming out. And then I just put the blood up to the test strip, and my monitor reads it. So my blood glucose level right now is 120, and we'll talk about what that means. So I got my number right, 120, but what does that mean? What should my number look like? What should it be? As always, the answer is it depends. It depends on a lot of different things, right? It depends on how long you've had type 2 diabetes. It depends on when you last ate, what you last ate, other things that you might have health-wise going on, other comorbidities. But diabetes professionals have a sort of range or a level that they recommend that you fall below. Of course, you should check with your doctor to see what your particular level is, and if it varies from this chart that we're going to post below in the comments. But for somebody who has type 2 diabetes that ate a meal in the past 1 or 2 hours, their number should fall below 180. So if we think about me, who just ate a big piece of chocolate cake, my number was 120. So that would mean my number is likely in the appropriate range. So that's a wrap on blood sugar, blood glucose levels. If you have any questions or if you want more information, feel free to drop a comment in the comment box or ask Dr. Martin this Thursday at 1 o'clock during her webinar about all things diabetes. Thanks for tuning in. We'll see you next week.